Hello, I'm Dr. Leanne Hassett from the University of Sydney, and I'm going to talk about the physical activity guidelines for people living with disability. So the World Health Organization updated their guidelines in 2020, and for the first time they included guidelines for people living with disability. So they recommend that both adults and children who live with disability should undertake regular physical activity if they're able to. In regards to the type and the amount of activity, the recommendations actually match what they recommend for the general population. So for aerobic type of activity, so that activity that makes you huff and puff, they recommend that for adults living with disability, they should do 150 to 300 minutes a week of this type of aerobic activity. If you can work at a higher intensity, so that huffing and puffing but probably not able to talk while you're doing it, then you could probably do a little bit less. And for children, they recommend that you should be active every day and try to fit in at least 60 minutes a day of that moderate to vigorous, so that huffing and puffing type of activity every day. They also recommend trying to do activity that works on strengthening your muscles. So for adults, trying to fit that in twice a week and trying to really involve those major muscle groups. And for children, trying to fit that in 3 times a week. They also talk about this multi-component type of exercise that works on functional balance and strength combined. And so, for example, exercises that might challenge your balance in standing, or functional activities like sit to stand, or even yoga is another example. And they recommend that for older adults living with disability, trying to fit in this type of activity as well 3 times a week. If you're already meeting these levels, and you wanted to do more, then it's likely that it would give you additional benefits. Now, there may be some people there who are nowhere near meeting these guidelines at the moment, and so they might feel a bit daunting. The guidelines do include some good practice points that are still really important. So doing some physical activity is better than doing nothing. So if you're not currently meeting the guidelines and you start doing some physical activity, that's still likely to bring you some benefits to your health. And if you're not currently meeting the guidelines and you start, then it is important not to just dive in and try and meet the guidelines straight away. So it's important to start small and gradually build up how many times you do it a week, how intense you do it, and how long you do the activity for. And when you do these activities, that the evidence would say that there's no major risks in being active, as long as you do it appropriate to your level. And certainly the benefits outweigh these risks for how much benefit there is of being physically active. Again, if you're not used to being physically active, then they also recommend you might want to consult a health professional, so like a physiotherapist or an exercise physiologist, to give you some advice about the type and the amount of activity to start with and to make sure that it suits you and that it's safe. And so they're the guidelines. And so when they've looked at whether people meet the guidelines, for both adults and children living with disability, find that they're twice as likely not to meet these physical activity guidelines at the moment. And so that's why it's really important that we look at strategies to help people to be more active. One way is for health professionals to be talking to people with disability about being physically active, so raising that topic and providing some advice. See your health professional and they don't talk about physical activity, you could raise that topic with them as well and ask for some advice or a referral to someone who would be able to help you. I hope this has been helpful and thank you for your time.